All right, guys. So another good and important component of history taking in patients is their past medical history. All right. So before you actually get to diagnosis patient, at least you should know that you should want to know if previously if they went to any other hospital and what was the medication that was given to them. Okay. Or were they under some herbal treatments, or were they under some self treatment and all that. Okay, so know their past medical history. All right, past medical history. This is the MBBS Niger. Kindly do subscribe to our YouTube channel. So our focus today is taking past medical history during patient examination. All right, so here we have the bad guys, virus. We have the bacteria, we have the everything, okay, that could actually cause an illness for you, just for illustration. Okay, so past medical history may be relevant to presenting complaint. Okay, so if the patient comes to you and he's saying that he's feeling pain is the presenting complaint. Okay, but you should know the past medical history. All right, because the past medical history could be as a result of a previous medication they took in. Okay, patient come abdominal pain, ask them, have they ever done any surgery? Okay, it could be as worst as maybe they did a surgery and they cut some part of the body they weren't supposed to cut. Okay, so past medical history is very important. So past medical history may be relevant to the presenting complaint, e.g. hypertensive with stroke or heart failure, haematemesis in a patient with suspected alcohol abuse. Okay, so just know what they did in their previous life. It could be what is causing what they are undergoing now. Okay, so past history of chronic diseases, and these diseases can include hypertension, diabetes, epilepsy, sickle cell, asthma. HIV should be obtained where relevant. Okay, so like you try to ask the patient, were you previously ill? Was it the same illness or was it another thing? Okay, and what was that thing that was wrong with you? And can you remember any name of the drug that the doctor actually administered to you? So you talk very calm, like a friend, okay? But basically, you are trying to get the information you need. You know, doctors are crooks. All right. So you should know about past surgeries, like I earlier explained. If they ever had road traffic accidents, okay, like let me say when I was young, when I was in my second year in high school, I fell from a tree. All right, so a stick went into my knee, okay, but it cut some. Okay, so they treated me for fracture, everything was nice. So I went to school, and when I went to school, the wound on the knee refused to heal up. Okay, so I didn't tell my parents because I felt they would quarrel me and all that. So I stayed the whole semester in school, and the semester in school in Nigeria is 3 months. Okay, so I stayed. Okay, it was in January, February, March. Okay, so April we came back home for Easter holiday. Then my mom saw my leg, and the wound has not healed up till now. Okay, but by now the pieces of the sticks that were in my leg had already come up. Okay, so when they took me to the hospital, the doctor had to ask me previously, okay, he fell from a tree, this kind of thing happened, this kind of thing happened, and he suspected that there are some particles of stuff that are inside my leg that are not supposed to be in my leg. That's why my leg is not healing. Okay, so this was how they took out the pieces of sticks, and the doctor was like, if I had left this thing to over 5 months or 6 months, they would have had to actually cut my legs. Okay, so that thing happened to me. Okay, so you always need to know the past medical history. All right, ask very friendly questions. Right, so this is it about past medical history, and bye for now, guys.